Happy August, everybody. This month's simulation focus is sepsis evals. So if you have a patient who needs a septic workup, the first thing that's going to happen is the provider team is going to place an order, and then that sends out a Vocera sepsis alert huddle notification. And so that notification goes to your charge nurses, and then the provider should already be at the bedside. So make sure to wait for that huddle for at least charge 1 or 2 to come to the bedside. The huddle purpose is so that everyone's on the same page, you all know what you're doing and why, and then to create a stick plan. So what's this baby's access? How are we going to give these antibiotics that are going to be ordered? Make sure that we give these antibiotics within the hour of them being ordered, so that kind of sense of urgency. And then, you know, if this baby's a difficult stick, maybe it's not the best time for an orientated try, or hey, this baby is a perfect opportunity. So that huddle is very important. It's part of our new sepsis eval bundle. So you need to obtain blood cultures usually, and then urine cultures. So sometimes we'll just do the blood culture without urine, but most of the time they're going to order both. And so these are both sterile procedures. So not like sterile, I'm closing down the whole pod and this is an OR, but like we're going to use sterile gloves and masks and a field and dump everything on it just so that we can be like the cleanest sterile as possible. So no purple gloves, no just haphazardly throwing things in the bed to collect. We're trying to get a really clean sample to put into our blood collection containers so that we can see if anything grows in the lab. So blood cultures, we're seeing what kind of bacterial growth. So you've got 2 options. This is our PEDS aerobic bottle. It's yellow, just like me. I didn't plan that, but you know, this is perfect for today. And then we've got an anaerobic bottle. If they're concerned about some sort of like GI gram-negative kind of bacteria, they might also order this, but the yellow is going to be your go-to. Just remember my little sunshiny outfit. And then if they order both, you're going to be collecting both. So you're going to get a helper. So that's all part of this huddle discussion, is who is going to be doing what. Always do this with a second person, sometimes even a third, but the minimum is 2 people. So never do this alone. You need the second person not only to help maintain your sterility, but to also help comfort the patient. So sometimes we forget, you know, the niceties of making sure the baby's calm. So if it's appropriate, sweeties, pacifier, swaddling, containment, shushing, music, whatever you can kind of do to create a calm environment as we're doing something kind of painful for the babies. So we're going to be setting up a sterile field. You're going to be wearing a mask, which I'm not going to do for the video because then you might be muffled with my sound. But anyway, you've got your blood culture container. You've got your transfer device. There's a special one for the blood cultures. And then you've got a transilluminator. I'm stuck with this one. And then ideally a cover. These are by the Pyxis machine. There's also sterile ones if you really prefer to use those. They're a little more large and unwieldy, but you can also use a cover. This prevents blood from getting in it and just makes the thing all cleaner. And then you're going to need sterile gloves, gauze, syringe, and butterfly. So we're no longer doing one-stop shop for blood cultures. You need a separate percutaneous puncture, whether that's a venous stick, which is first line, or an arterial stick if you can't get anything venous and you need to ask someone to do that, or if the blood volume that you're needing is a lot because you're doing a bunch of other labs. So I've already kind of put a lot of this stuff on my sterile field. I am going to use the alcohol swab sticks. So this is the antiseptic of choice for our blood cultures. So we're prepping the skin with the swab sticks. Alcohol is the choice. It's quick drying, and the sticks just prevent you from having to touch the pad and then accidentally maybe touching the site. So swab sticks for the win. And you can kind of do this so they don't touch. And then I'm going to use some hand sanitizer and get my sterile gloves on. Okay, so I'm going to prep my supplies. This comes all squirrely. It's really helpful to kind of stretch this out. That way it doesn't bend at all. And then you can kind of take this cap off. You can connect these 2 things, and then your partner can help hold that for when you're ready. So the next part is to kind of grab all the things and try to be as sterile as possible. So I've got this like fun little baby I'm going to pretend is the baby here. And then I'm going to get my transilluminator. We're going to get that in position using my gauze. Oh, these veins look so nice. Okay, so we're going to clean with my alcohol. You're going to use 3 different sticks. And I need to readjust, so I'm going to grab this. Real life here, this baby is wiggly. Okay, so needle safety. You got to use your hot needles, so make sure you say hot needle, and then your partner is going to grab that off. I don't have one today, so we're just going to pretend that they did that. So hot needle, and then they're going to hold my syringe for me. The trick with butterflies, bevel up always, and I like to hold this. Some people like to hold it together like this. It's however you want, but just don't push that little black arrow, which will retract your needle. Okay, so we've cleaned with alcohol. I'm wearing my mask. I'm in my sterile gloves. They haven't contaminated my site. Stick at like a 15 to 30 degree angle. As soon as you get flashback in the tubing, your partner can start drawing back slowly. You don't want to draw back too quickly because that can compress the vein. And you're going to draw back. Hopefully you're going to get 1 ml of blood. That is the blood volume that you need for a blood culture. Minimum is 0.5 mLs, but 1 ml is the right amount for like not bloodletting the baby, but also getting enough for the culture to be able to grow. Okay, so I've got my blood. Got to be really careful here not to stick yourself. Hit the black button, retract, and then keep this all sterile. The next part is very, very important. You have to flip the lid and then vigorously clean this rubber stopper with an alcohol pad. And let it dry, just like you did with the baby, before you stick the blood sample in. In order to do that, open this up. Take this outer ring off. Careful, because this rubber stopper has a needle here. You're going to attach your sample and then stick it in the culture bottle. So if you had other labs that you drew, the culture needs to be obtained first. That means you stick it in here first. But if you lose track of yourself, you might just let it all get sucked in. So you either have to let the syringe go in really slowly with your hand on the plunger, or you can be watching it and grab it out before it goes all the way in. You're going to oscillate this about 8 to 10 times to get a good mix. Make sure you've printed and scanned your labels and labeled it appropriately. You're going to double bag it with a red specimen bag and send it to the core lab. And then we'll see what grows. Hopefully nothing. Thanks.